313watkins.com. Streaming on Roku.
You wouldn't have to go anywhere because this is the Talk Beat Jones, and All right, family. We're live on the Talk Beat Jones show today on a Wednesday. We're here live every Wednesday from 10 to 11 a.m. Please let your friends know that. And, of course, you can watch us on the YouTube, TV33 On Demand. You can go to the R.J. Watkins page. That's R.J. Watkins page, in which you can go through, hit R.J., the black and white, hit above where it says R.J. Watkins, hit it, and you will see come on your screen the little red and white. It's the red and white. That's the one that you want to hit to watch the show. Pass that word to your friends so they'll know how to watch the Talk Beat Jones show on live Wednesday, and call us potentially. Down below I have Dr. Watson, Dr. H. Jeffrey Watson on the line, ready to come in and talk to you about his perspective from the Health Beat. Don't forget also on Sundays that you can watch the show on 15.2. And also, family, we're going to talk to you about that Cash App. That's right. Still going to talk to you about that. And I haven't spoken to him, but I do want to say to the power of love and the power of glory and the power of health to our CEO, Mr. Just had to say this. We love him. We respect him. We appreciate him. And let's support the station, family, with Mr. R.J. Watkins. Let's give him something to get healthy and feel good about. Send him some money, send him some love, and send him some prayers. We appreciate that. And prayer warriors, let's get busy the way that we always do. Right about now, I'm going to just stop right about now and do this. We have H. Jeffrey Watson, Dr. H. Jeffrey Watson, MD, on the line, ready to come in with the Health Beat perspective. Dr. Watson, are you there?
I'm here, Billy Jones. How you doing today?
We're going to bring you up a little bit so we can get you real good and loud here. Try it again, Doc.
I am here, and I'm wishing all the blessings to the family. And just want everybody to be healthy, because your health is your wealth. And when you have your health, you have everything.
Right, right. Well, you know, sometimes we have backgrounds, and I'm going to cut them down so we can't hear it. But that's what's going on now. And that I want you to take over. And you mentioned something about water. And
yes.
But I want you to bring them first, Doc. Can you tell them why it is important for them to understand what is telehealth?
Telehealth.
Yes, telehealth. I keep saying telehealth. It's telehealth. Yes.
Telehealth. Yeah, telehealth is very important. You know, prior to COVID, doctors weren't really allowed to do telehealth. Lawyers could do it. You know, when you spoke to your lawyer, they would hit the clock and time you, you know, and I could hear them doing it too.
Yes.
So, you know, let's say they were going to charge you $400 an hour. Well, for 15 minutes, they're going to send you a bill for $100.
Yes.
Now, doctors really couldn't do that. You know, you call your doctor and ask for a refill or this or that, but they couldn't really charge you for it. But when COVID came, they wanted to make it safe for people, because they didn't want people in a crowded doctor's office passing COVID around to everybody. So the government, and particularly Medicare, Medicaid, made it legal to do telehealth.
Yes.
And
yes.
that could be over the telephone, or it could be over a Zoom, or other situations in which you could visualize. The doctor could then examine you, and this became very popular for psychiatric providers.
Okay.
The doctor could ask you questions about your feelings, your emotions, these kinds of things, because the psychiatrist really didn't have to do a physical exam.
Got it.
So it became very popular. We did a form of telehealth starting on SoulBeat,
Yes.
in which people could call in and ask questions.
Yes.
They would ask questions about their family members. They would ask questions about certain signs and symptoms. So they might say, I'm real thirsty all the time. I got to pee all the time.
Right.
I've lost a lot of weight, and I seem to be getting numbness in my feet.
Right.
Well, I would tell them those are signs and symptoms of diabetes.
Yes.
And, so it's mainly an educational, and you need to get that checked. Now, I didn't order medications for them over the television show, but nowadays, if a patient calls or we put them on the schedule and I call them,
Yes.
I can order medications electronically.
That's huge, doctor. That's huge, Dr. Watson. That's huge that persons can call and have you as their primary, as their physician, and you're able to do all that a physician will do to take care of their patients.
Right. Now, one thing that's kind of tricky is pain management over the phone.
Yes.
Like, let's say you had somebody that you never saw before, you never examined them before, and most of my telehealth visits, which happened after COVID began, were people that I already knew, had already examined.
Yes.
And we had a policy that, if they did have pain, our office stayed open, but, you had this concern by the government that people were selling their medications and so on.
Yes.
So we had some real strict rules that for pain and narcotic prescriptions, they had to come in and be physically evaluated.
Correct, yes.
But if you knew they had diabetes, sometimes we could pull their labs from a hospital and we could see what the chest x-ray looked like and what their urine result looked like, and did the doctor give you any antibiotics? Because I'm seeing that when you went to the hospital, your urine test had bacteria in it.
Wow.
No, it didn't come back before I left. Well, I see here, I'm going to order you some antibiotics. Are you burning when you pee? Have you had a fever? Does your back or your kidneys hurt? These kinds of things. So
yes.
Telehealth is very important today in really most aspects of healthcare. And so we are definitely open to any of the people from the community calling in, and if they have questions about health and the healthcare system, about their health, their family members' health. I've served as a clinical professor at UC San Francisco, Touro University, and several other places in which I try to teach people about issues related to their health.
Yes.
So we encourage folks to call in, and we'll be glad on our Health Beat segment with Mr. Billy Jones and Talk Beat Jones to be able to answer those questions. Now I have a question for you. Mr. Billy Jones. What is the weather like out there right now?
The weather out here,
Detroit?
the weather out here is just absolutely gorgeous, beautiful. 70, 80s.
Okay, so it's starting to get warm.
Yes.
Is it humid or is it dry?
Well, compared to the Bay Area, which gets that breeze off the ocean there. Now they tell us, again, you're talking to a person who is not from, quote, Detroit, So I'm giving it to you from the comparison to the Bay Area to here. That
Mhm.
that breeze from the ocean would always keep things kind of like where you're cool. Here,
Mhm.
the intensity of the heat for a person like me is just crazy. Sweat, sweat, sweat. Because it just seems to be no breeze. No breeze. They say that Michigan is what, 5 lakes. Uh,
Mhm.
I guess I'm not going by the lakes.
Well, one of the reasons that I bring it up is that this is the time of year that people are going to be addressing water issues,
Okay.
and I mean water in their body.
Okay.
And the reason, and because people are going to be sweating, they're going to be swimming.
Yes.
When they exercise, they're going to sweat more,
Yes.
and things will happen. So here's another quiz question for you, since nobody has called in yet. How much of your body is water?
80%.
It's about 60 to 70% in men.
Okay.
Men are around 60%, and more of it is in the muscle tissues.
Yes.
Women have a little less. They're about 50 to 55% because they typically have a little more fat in their body than muscle.
Right. Right.
Infants have the greatest amount of water in their body, about 75 to 78%.
Yes. Yes.
Okay?
Yes.
Now here's another something interesting. Of the body water, about 73% of it is in the brain.
Wow.
So you see people, you hear of heat stroke, right?
Yes.
You hear when it gets hot, people, if they're dehydrated, if they don't have enough water in the brain, they get dizzy and they pass out. So that's why it's so important during the hot weather times for people to drink enough water. The lungs have about 83% of the water that's in your body.
Okay.
The muscles and kidneys, about 79% of the water in your body, and the bones even have water,
Wow.
31%.
Wow.
The skin has 64% water. And that's why you see all these people putting lotions on to rehydrate their dry skin.
And
So,
mhm.
so we want to stay hydrated
Well, doctor,
during this time when we're about to start getting these heat waves.
let me
right?
let me ask you a quick question with that. Please don't change your thought. This is in the
Mhm.
same vein. Would this be a process that for folks who are high dehydrated, semi dehydrated, could start going through what you call a brain fog, where you get forgetfulness? You get a lot of forgetfulness going on in your process of living your day-to-day life.
Absolutely, yes. Because if your brain is not hydrated, you will get brain fog, and you don't focus as well. You don't do as well in school. These kinds of things. So it's very important. I'll give you an example.
Yes, sir.
And I don't know if a lot of people know this, but if you like sports, like basketball, football, particularly football, because it's hot. It's most of the time it's played outside. It's hot.
Mm-hmm.
The pros at halftime, they don't just go in and drink some Gatorade. Sometimes the doctor gives them an IV
Wow. Okay.
intravenously with saline and glucose in it,
Right.
because the
right.
brain requires some sugar.
Okay.
And you see them run back out. You sitting in the stands sweating, right, with a fan and all that kind of stuff.
Yeah.
And they jog right out on the field. Sometimes they give them intravenous fluids,
Mhm.
and that's legal, as long as it's not steroids in it or something like that.
Yes.
But it's important. Now, a lot of people are going to ask the questions, okay, well, how much water should I drink? And certain other drinks like tea, coffee, sports drinks, they all contain water. And so the general medical thought is 11.5 cups, because a cup is almost a half of a glass, to 15.5 cups a day, or just like Mom tells you, 8 glasses of water a day. 8 glasses of water. So when it's getting hot out
when you
there-
say water,
Mhm.
when you say water, now you're not saying. I'm just asking the question, not a statement. Asking the question. So that 8 glasses of H2O is not the same as drinking 4 glasses of H2O, 2 cans of Red Bull, and some more, and some Gatorade, and some Vernors.
Well, I'm really glad that you asked that. You don't just have to go to the tap or go to the store and buy bottled water and have to drink 8 bottles of it a day.
Okay.
Because orange juice, grapefruit juice, some of the flavored waters, Gatorade, tea, coffee, and even milk all have some water in it.
Okay.
And those can count towards your water intake,
Okay.
because you want to make sure that you don't get dehydrated. Water is necessary for your saliva in your mouth. It's necessary for your urine. It's necessary to keep your body temperature down.
Mm-hmm, mm-hmm.
And also for digestion. It helps to bring oxygen throughout your body. Now, you might say, wonder if I'm drinking enough water.
Yes.
Well, one easy way to tell, certainly you could go to the doctor, and the doctor can check your blood pressure. If your blood pressure is real low, it might mean that you don't have enough fluid in your system.
Okay.
Now, other things, you might have somebody that has swollen ankles, and you listen to their lungs, and they might have too much water on their system. If they're wheezing and their ankles are swollen, they might have congestive heart failure or too much water.
Mm-hmm.
So there's a balance. Now, let's say you're at home, though, and you pee, and you look down and your pee is dark orange or brown. That means you don't have enough water in your system.
Yes.
You should look down, and your pee should be, the lighter it is, the more clear it is. That shows you that you have more water in your system.
Right, right.
So that's the way to check yourself before you wreck yourself. Right?
So
now here's another thing. When I work in the hospital and somebody's really sick, let's say they go into a code blue situation, meaning their heart starts to race, their blood pressure drops, they're not breathing good. That usually tells us that their body is building up acid in the body.
Wait, could you say that last part again, Dr. Watson?
Okay, so when I'm in the hospital and a code blue occurs, meaning that the person's heart isn't beating right, maybe it's beating too fast, in a code blue their blood pressure drops, they may not breathe good, and as a result of them not breathing good, or having infection in their body, or having a ischemic heart attack, meaning lack of blood flow, the carbon dioxide level in the body raises, and you develop an acid situation in your body. Acid. So what, in a cold blue, one of the more common things to do, and I did this very frequently, is you give intravenous bicarbonate. Intravenous bicarbonate. The natural acid-base balance, or pH, in the body is 7.4, is what the pH is. If the pH is below 7.4, that means that the body is getting in an acid situation. If the pH is above 7.4, that means they're getting into a basic situation. And your body cannot function well in an acid situation. So let's say, let's take it to a healthy person. You lifting weights, you jogging, you're doing squats. Your muscles release lactic acid.
Right.
Lactic acid. So now, here you're outside running around Lake Michigan and exercising, or you in California running around Lake Merritt, and you don't drink enough water to pee out the lactic acid, now you get cramps. You get cramps in your muscles, cramps in your calf, in your back, in your feet, and sometimes that's because of the lactic acid buildup. So you see most athletes, even in the gym, they usually have a pitcher or a bottle of water or some Gatorade or something to reduce the lactic acid. In the hospital, the way that we do that in a seriously ill person is we add bicarbonate to the intravenous fluid to take away the acid. So this time of year, water is very important. Very important.
Well, I found that when I'm dehydrated, that the back of my thighs, the hamstring area, tightens up, and it's almost like it's very difficult to walk. Yeah, it's almost like
you get a cramp.
Yeah, it's almost like I'm pulling the muscle.
Right.
But Doctor, let me ask you this other question real quickly. This is personal. Now this is Doc, this is just between me and you. Nobody else, just between me and you.
But you're telling everybody on TV about it.
Oh.
Don't make it too personal now.
I better change that personal question. But here's a question. During my career, I have broken both of my ankles. And, of course, when I got in shape, quote, in good shape, then I didn't have issues per se. Once age and time and lack of condition, so now you're having the swelling that I'm saying is not because of something else going on. It's because of the process where those areas were injured, and they are doing whatever they're doing to sometimes swell up on me when I'm active. I got about 1 minute for the answer, Doc.
Well, that's possibly because of inflammation. Inflammation. Now, the body will recruit fluid to a joint to try to bring it the anti-inflammatory responses. So can
I have this answer on the other side of the break, because there are other folks out there who have the same similar situation, Doc. So I want you to take a moment with this if you could.
Okay.
Okay, we'll be back, family, right after this commercial announcements. Don't forget, go to the Cash app. I'll give you the information. The information may be on the commercial, but I will personally give you the information when we come back. Do this. Let's take the stress, the pressure, and let the CEO know that he has folks that got his back. Help us out. All I'm asking is love. See you back very shortly, family.
The Talk Beat Jones and
Justice for Mario Willis. Truth. Facts. Evidence. Matter. Log into justiceformariowillis.com. Read for yourself.
You're watching Detroit's own WHPR TV. Detroit Live.
Hi, this is Billy E. Jones, Talk Beat Jones. You can watch me 24 hours a day, 7 days a week on WHPR TV 33 Now app. Download our free app at WHPR TV Now.
If you enjoy the music, the talk, and the vibe right here on WHPR, we need your support. Help us keep independent radio alive by sending a Cash App donation of whatever you can to $WHPR TV Radio. Every dollar makes a difference. That's $WHPR TV Radio. Support the station that supports you.
We are now streaming on Alexa. That's right, we're streaming our TV audio worldwide on Alexa. To get us, just say,
Alexa, enable Watkins Broadcasting.
Okay, here's Watkins Broadcasting. Starting the Watkins Broadcasting live stream.
now Alexa will allow you to listen to your favorite TV programs. Remember, to get us, just say,
Alexa, enable Watkins Broadcasting.
Okay, here's Watkins Broadcasting. Starting the Watkins Broadcasting live stream.
We're streaming our TV audio worldwide.
I'm Wayne County Treasurer Eric Sabri. If you're behind on your property taxes, we have programs to help. You don't have to lose your house, and you don't have to pay all at once. This summer, our mobile unit will be visiting Wayne County communities to help make it easier to start a payment plan and keep your property. Go online or call to find the plan that's right for you and where you can get help from our mobile unit. The last thing I want is for anyone to lose their property to foreclosure. Make your payments every month and keep your property.
Hey, what's up? This is Timmy Tim. I got all of Detroit on lock to bring you the best in late night entertainment, from music videos to artist interviews to concerts and special events. So you rappers, comedians, club promoters, small business owners want to be on Timmy Tim Live? Give us a call at 313-828-0848 or email me at timmytimlive@gmail.com.
313watkins.com. Streaming on Roku.
You wouldn't have to go anywhere because this is the Talk Beat Jones, and
All right, this is the Talk Beat Jones, and I'm Billy Jones, and of course we have on the airways with me today, of course, every Wednesday we have Dr. H. Jeffrey Watson, MD. Of course, he was talking about that telehealth. I think I got it right this time.
Telehealth.
What is it?
Telehealth. You
Telehealth.
said it right. This time.
I'm going to bring you right in right now, Doctor. We don't talk about the fact how they can get us and how they can see us, because I want to spend this time talking to you about them ankles that's swollen up, not, I feel, behind something else, but behind being broken, both ankles being broken, walking, of course, being off-centered, etc. And when I'm jumping and moving, puts pressure on the areas. And I just got to get back in shape and toughen them up again, huh?
Yeah, well, people in Detroit probably don't know about your famous Jonesercise.
Not really.
Billy Jones on Jonesercise, and people, just like they had Jack LaLanne on TV,
Yes.
People will come on and watch Billy Jones on TV doing Jonesercise, a great athlete.
Yes, sir. Thank you. Thank
but
you.
you mentioned that after you had broken your ankles, that
Yes.
sometimes you would get swelling in the ankles. And we've been talking about water today, and water in your body, that your body's about 60%
Yes.
water.
Yes, sir.
But if the ankles are swelling, there's a couple of different reasons for that. One can be that there's inflammation in the joints. So water brings white blood cells and anti-inflammatory fluids to an injured part of the body, like the knee or the ankles.
Yes.
So sometimes people can get swelling from that. The other, and that's probably what's happening in your situation. The other thing that can happen is you can get a venous insufficiency. In other words, the blood vessels of the legs start to dilate and they don't contract well, so they let the fluid stay down in your feet.
Mm-hmm.
And so, if you take a long plane ride, you might get, when you get off the plane, you might have swelling in your feet because you haven't moved around and pumped your ankles and your feet, which pumps the blood back to the heart.
Right.
So being in a situation where you're not mobile can result in swelling in the ankles. The more serious things are congestive heart failure. So the heart in congestive heart failure doesn't squeeze well enough, and as a result, it's like a sock that loses its elasticity. And as a result, it doesn't pump the blood back to the heart well or around the body well, so blood and fluid stays down to the lowest part of the body because of gravity, and the fluid seeps out of the veins into the soft tissue. And we call that edema.
Right.
And that's totally different from the inflammatory process that we talked about. So in yours, you got to start, get one of those pedals you can put under the desk, and you can just pedal it while you're sitting at the desk, right?
Right.
Have you seen those before?
I have one.
Oh, you do? Okay.
Yes. Yeah. I believe in the process. It's like I'm going to say it this way. It's like probably about 70% of the folks, we believe in the process. It's just getting us physically to do the process now.
To do it, huh? Yeah. Consistency is the name of the game. Consistency is the name of the game. Now, we've been talking about water and how important it is that males, they need to drink about, we said 8 glasses a day, but the water needs in the total body are about 3 liters of water in the male. Women don't need quite as much water, about 2.2 liters. But if you get up to 8 glasses a day, which is like 2 cups of water or juice or Gatorade, it could be tea, it could be coffee, and even milk can give you some water replacement. Now, here's the flip side. Water isn't always the best thing for you in certain situations. So now it's getting hot, and drowning, more than 1/2 of all drowning occurs during the summer months.
Okay.
Yeah, that occurs during the summer months. And we know that you have lakes and rivers and streams, so you got to really be careful. Always make sure that the kids wear some kind of flotation device, and that the children ages 1 to 4, those are the ones that will fall into the pool or fall into the water and don't know how to swim yet and drowned. I remember we went to Hawaii, And my friend brought his kids, and it was actually the medical convention. My friend brought his kids, I brought my kids. My kids were about 4, and his kids were about 6.
You talking about your twins,
7.
right?
Hmm?
Talking about your twins?
Yeah, my twins. And so they were the 6 and 7-year-olds. They were jumping in the water and swimming to the other side and all this. And I was walking around the pool, and then I saw my little boy jump into the water, thinking he could do the same as the 6 and 7 years old.
Right.
And 1,000, 2,000, 3. I saw he didn't come up. He did not come up. He didn't really know how to swim.
Right.
And I jumped in there and snatched him up real quick and
Yes.
pulled him to the top. And I said, "Now don't do that. You don't know how to swim yet."
Yes.
So these kids, it's a risky time. So make sure that there's somebody to supervise, that you use life jackets, and that there is someone who can go in and get them if something happens. Now, the other thing that we know, we want everybody to drink 8 glasses of water a day, but some places the water has bad elements in it. And we know that in Mexico, for instance, if you drink the tap water in Mexico, it might have what we call E. coli bacteria in it. And people are traveling here this summertime, and that E. coli bacteria get in your stomach and give you diarrhea. And you may vomit, you may get a fever, and then that can cause dehydration. So I always suggest that people who are traveling like that get bottled water. And not only that, if you were in Mexico, you would say agua con gas. You know what that means?
No water?
No, that means water with bubbles in it.
Water with bubbles.
Right.
The essence.
Because
Okay.
sometimes they'll go in the back and they'll get a pitcher and take the hose and pour it in the pitcher, and you think you got a sample of bottled water, but they filled it up from the hose, right? But if it's got bubbles in it, then it's got to be some kind of mineral water or something like that. So agua con gas. Now we know also that in places like Michigan in the past, they've had some water quality issues.
Oh yes. Oh yes.
Yeah,
Flint.
Flint, Michigan had a water crisis in 2014. And they found that from the lead pipes, that there was some lead in the water. And then they found that in some cases there was this bacteria in the water that caused the Legionella's disease.
Yes.
Legionella's. That was kind of a pneumonia. They had, if you got around a place where there's industrial dumping like paper dumping. Well, this happened in Kalamazoo. That the byproducts of the paper dumping ran off into the water and caused people to get sick. And then if you're around a place where there's a lot of agricultural stuff, like let's say you got people growing fruits and growing vegetables, and that they put sprays on them, to keep the bugs from eating them up.
Right.
And then the water drains into the
reservoirs.
A main water system.
Right.
And so then you got water toxins. So agua con gas, or water with bubbles, that's a good way to go to make sure that you got pure water. Now
what about the hose? If they take and giving you water out of the hose and putting it into the containers or whatever.
If you're in Mexico, no. I mean, you have you have resorts now that really have water purification systems in them, but just as a general tip, it's just having water poured into your glass, you take a little bit more of a risk of getting what they call Montezuma's revenge, which is, and it's happened to me before. Yeah, it's happened to me. I got sick with it. And I'll tell you something else, which would be a surprise to you. Even if they put ice in your glass, that ice melts, and that ice is from the hose water. Okay? And so that ice can have, you say, agua con gas with no ice. Okay? And that will protect you a little bit more. So the importance of water is just so important. Now, in one thing that we found by accident is that people who are on dialysis, they have to have water go in to their blood system and take blood off of them, and then the blood goes back into them. They found that that a certain group of patients who were on dialysis developed a situation called dialysis dementia. Dialysis dementia. They started getting confused, and when they really did a lot of research study on it, they found that there was mercury in the dialysis water. Mercury, yeah. So, well, it used to occur a lot. When I was coming up through training, and I would say this would be in the early 80s, that became a common situation. So they started to try to develop situations that the water that they used in dialysis was more pure. And so we don't see it that much now, but that was a thing that happened, and it wasn't rare. Of course, now if you go into an old house, you might get lead in the pipes, right? And lead from the pipes might get in your water too. So you got to be careful. So sometimes people will get purification system for their sink and for their, they have different kinds that will help to purify the water. You can put it into a jug, and the jug may put it through a purification system. There are others that do an electrolysis type of situation where they charge the water and try to clean it up that way. When I was 15, I went to New York with my family, and we went to my sister's friend's house. And it was hot. It was hot. It was 100 degrees in New York City. And I said, "Ooh, let me get some water." And I went and got a cup and turned the cold water on. The water was brown. Have you ever experienced that? Mhm. Mhm. Mhm.
That you had to let the water run. You turn it on and let the water run.
Right.
Yeah.
And that may be lead, in there. But I was so shocked. I hadn't seen that before.
Right.
I haven't seen that really since. But we got to be careful.
Well, they've gone through. If my memory tells me correctly, I do believe that Detroit went through a phase where they were replacing a lot of the lead pipes.
Mhm. Yeah, particularly in the older houses.
Yes.
Yeah, but water is still so important. Males, 60% of their body is water. Females, 55%. And in men, the water's in the muscles, and about 79% of the muscle has water in it. Infants, the total little baby, that's why you get that water for babies. 75% of an infant is water, and the brain needs water.
Yes.
Now, when I used to work with my fighters, they would have to come down to a certain weight.
You're talking about your professional
my
boxers.
professional fighters, yeah.
Okay.
Yeah, they'd have to come down to a certain weight before the fight. So they might, a week before the fight, they might be 170 pounds, but they had to be 160 at the time of the fight.
Mm-hmm.
So the coaches tried to do things, make them exercise a little bit more to get the water down. They did one thing that was very interesting was put Epsom salt in a hot bathtub.
Yes.
And get in the bathtub and soak, and the Epsom salt would pull the water out of your tissues.
Yes.
And that would lower your body weight.
Mm-hmm.
But once they weighed in and they made weight, they would go to drinking a lot of water, Gatorade, eat a good meal. And let me say this also. Food has water in it. Not just clear water in a bottle or from the sink, but certain foods. And there are a lot of fruits that have water in it, like cantaloupe has water, a lot of water. Watermelon has a lot of water. Strawberries has water in it. So you can gain some of that water back with some of your food and certainly drinking, and that's why you see people.
Doc, do you know what just hit my mind when you're saying
What's
this? And we're talking about folks who are trying to lose weight and say, I do everything right. I eat my vegetables, I eat my fruit, and I don't eat the meats and stuff, but I just eat my vegetables and eat my fruits. So if a person is doing that, but they're consuming a lot of fruit, could that be a weight issue?
It could be, particularly if the fruits have a lot of sugar in them. That could. But sometimes, people will eat fruit, but they'll put some whipped cream on it, or they'll put something else. They'll have cereal with fruit on it, and the cereal may have a lot of carbohydrates in it, and so they get a little bit confused. But you said something very important that I did mean to bring up when you're talking about diet. If you drink a lot of water when you're on a diet, it will fill your stomach up. And water, just basic water, has no calories in it. The regular clear water that doesn't have sugar has no calories in it, so you don't feel hungry. You don't feel hungry, so as a result of that, you have less caloric intake, and your body can start to lose weight.
Right.
So very, very important. That's a good point. That's a good point. Now, did you get the results of the voting yesterday there in Michigan? Have any of the results come out?
I'm glad that you're bringing this out, because one of the things I was going to wait till next week to speak about the participation with the Talk Beat Jones and what we're doing and what we're accomplishing at this point. We're bringing in an expert. We're bringing in one of the top individuals in all of Detroit to be the political beat personnel here on Talk Beat Jones. She will be in next week. I believe she'll be in next week. I will be sitting next to her. However, I will just be sitting there because she will be able to handle all of her presentation of what she will be doing, how she will be doing it, when she'll be doing it, the whole particular. This is a tremendous addition to the Talk Beat Jones. Yourself and my new person is going to be the person that makes the program here the show to watch, to listen, to learn. The show to watch, to listen, to learn, and to be loved, and to be careful about what you're doing with your life. Because if you understand and you have knowledge, then you can have a greater, better life. So with yourself, Dr. Watson, and with my friend that's going to come in, introduce themselves, I think that we will have a very high quality program of presenting these issues. You're a political person as well as a health person, but folks also have to remember, Doc, maybe you can help me with this too. Do you just do the outside of the body, or do you just do the inside of the body, the bones, etc., or do you also work with the mental issues?
Well, that's a good question, Billy. As an internal medicine doctor, internal medicine addresses, and I say it simply, from your nose to your toes and everything behind your nose, which is the brain. So we, as an internist, we deal with your inside organs, your heart, your lungs, your stomach, your genitourinary system, the hormones, and then neurologically, strokes, tumors in the brain or anywhere in the body. But health is a state of spiritual, socioeconomic, psychological, and physical state of well-being, and not simply the absence of disease or infirmity. So when you get your political person in there, hopefully they are going to help us to understand the platforms that the politicians are doing for housing. Because if you don't have a place to live, that's a socioeconomic problem, which is a health problem. And if they have a mental health problem, that also is a psychological issue that needs to be addressed, because that can result in homelessness, it can result in violence, it can result in suicide, all these kinds of things. So right now, at least in California, and actually all over the United States, we've been talking about the issues that relate to health.
Yes.
And they are very, very, very political right now, which we've talked about several weeks in a row, is the big, beautiful bill.
Yes.
In which a lot of people are going to lose their health insurance.
Did you say 10 million?
10 million in the whole United States over the next about 7 to 8 years. And in California, 1.8 million.
Wow.
And those who are going to lose it are going to be immigrants, and even if they're a U.S. citizen, there's going to be challenges with them. And the other ones that are going to lose it are poor people who don't know when to reapply for their Medicaid.
Yes.
And that means they're going to have to reapply every 6 months. And and that never used to be the case. When I would help people to determine if they were disabled or whatever, they'd have to go to the doctor, and the doctor would have to write a report saying they're disabled and poor and can get on the Medicaid. But you figure now, what the social services have told me is that everybody's going to have to do it online. Well, I spent 2 hours yesterday trying to figure out a new electronic medical record system, and I had somebody on the phone with me for 2 hours.
Doc, we got
from
New
York.
We got 2 minutes, Doc.
Okay.
Continue, please.
Well, hopefully we'll have some better outcomes with our healthcare system. But everybody should remember that prayer and meditation is number one. Read and gain knowledge about our political systems, number two. Number three, eat to live. Don't just live to eat. Make sure you drink plenty of water. 4, exercise regularly. 5, rid yourself of addictions. 6, get enough sleep. 7, commune with nature. Be careful if it's hot. And 8, get your regular checkups. Get your regular checkups while you can. Your heart, your prostate, your breast, the colon, your blood test, your sugar, your cholesterol, all these kinds of things, because remember that your health is your wealth, and when you have your health, you have everything. And thank you, Mr. Billy Jones, for doing the things that you do, and Mr. R.J. Watkins, and for educating our community on some of the most important things, which include health and politics.
Well, I'll tell you, the engineer, Tim, and I, we've had some discussions, and we're looking to do some wonderful things. And like I said, just putting everything in place. Like I said before, we're not here just to come in and say we're on television. We're here to compete. And when I say to compete, we're competing with love, because we want our folks around the world to understand the complexity of living life, but yet the simplicity of living life. And if you got the right folks telling you the right things, then you got it made. You can do these things. And that's what we're doing here on the Talk Beat Jones. And, you know, Doc, we ask folks to go to the Cash App and hit that $, and then you hit WHPR-TV.radio. So, excuse me, just $ WHPR-TV radio. That's all you have to do to show your support. And family, we want you to support this station. We want you to support our CEO, Mr. R.J. Watkins. And I want the prayer warriors to come on out, get busy. Let's put the prayers and touch this station with love, caring, and blessings. I am Billy E. Jones, letting you know that we love you, we appreciate you, respect you, along with, say your goodbyes, Dr. Watson.
All right, remember that if you knew better, you could do better. And here's where we give you the information so that you can do better.
All right.
God bless.
Bless you. And thank you so much, very much, Dr. Watson. So family, please share us, like us, love us, and again, be with us next week. And go again to pick us up, share it, let folks know this is the program you want to be involved with. Talk Beat Jones. Have a great one. Bye now. Thank you, Tim.
You wouldn't have to go anywhere, because this is the Talk Beat Jones. And
.313watkins.com. Streaming on Roku.